Hi guys! So today I wanted to do a little video on how to do a basic head-to-toe nursing assessment on your patients. So I just want to do a little disclaimer before I jump right into this video. This is going to be sort of my basic head-to-toe assessment that I do on my patients when I am at the hospital. This is a very general assessment. It is not a very focused assessment. So if you have a patient that is in the hospital for COPD, obviously you're going to spend more time focusing on their lungs. Or if you had a patient that just had a bowel resection surgery, you're obviously going to focus your assessment on their bowels and their incision site and all of that. So this is going to be a basic head-to-toe assessment. It's not going to dive into focus assessments. So as a nurse, that is your responsibility to identify what you need to focus your assessment on for your different types of patients. So the first thing that I do for my head-to-toe assessment is I walk into the room and I introduce myself. Hi, my name is Ashley and I am your nurse today. I'm just going to be doing a basic head-to-toe assessment this morning. Tell me how you're doing this morning. So I always like to ask my patients how they're doing because a lot of times they'll give you a great idea on how they're feeling this morning, if they're in pain or, if they had a good night or a rough night. So after my introduction, I just like to take a set of vitals. Sometimes at hospitals, CNAs do this. Sometimes it's the nurse's responsibility. But I like to do a set of vitals. This first gets me warmed up to the patient. The patient can warm up to me, and everyone knows how to do a set of vitals. So I get the temperature, I get their heart rate, I get their respiration rate, I get their oxygen saturation, and I also ask about their pain. Now this is critical to do at the beginning of your head-to-toe assessment because if your patient is having pain in their belly or pain in their legs, you're obviously going to want to be sensitive to that and be careful in those areas so that way you don't cause them more pain. So while I'm doing my vital signs, I am talking to the patient. How did you sleep last night? Are there any new issues that you're having? Just getting to know them a little bit. This is basically your neuro assessment. So you're finding out, can your patient understand you? Is your patient moving around? Does the patient know their name? Does the patient know where they're at? So when I first learned how to do neuro assessments, we learned about the cranial nerves and all of these different neuro assessments, and I was really overwhelmed by it. But basically, your head-to-toe neuro assessment is just you talking to your patient, finding out if they're oriented to the room and their name and their situation. So after that, I like to go into my head-to-toe assessment, and of course you're going to start with the head. So you're looking at their head. Is there anything abnormal? Does their skin tone match? Do they wear glasses? Do they wear hearing aids? Are they having any abnormalities? Do their lips or mucous membranes look dry? You can get this information by just looking at your patient. Next, I move down and I go to the heart and lung and bowel sounds. So I listen to the heart. So for the heart, I am just listening to the heart sounds. Do they have a normal heart rate? Can you hear S1, S2? Do they have murmurs? For lung sounds, you're listening for any adventitious lung sounds like wheezing or crackles or rhonchi, and you want to make sure that you're comparing both sides to get the different lung sounds on each side of the lungs and throughout the lungs as well. When I'm listening to the bowel sounds, this is usually when I ask my patient when their last bowel movement was. Being in the hospital, chances are your patient is on some type of narcotics, and that can slow down peristalsis, and so constipation is a big risk when you're on those medications. So if your patient hasn't had a bowel movement in 5 days, are you going to be a little concerned? Yeah, you're going to want to probably call the doctor and do something about that, and so that's why I ask when their last bowel movement was. After I listen to the bowel sounds, I move to the arms and hands, and I'm just looking at the skin. I'm feeling if it's warm, moist. I'm doing cap refill, and I'm checking for pulses. I usually tend to do the radial pulse because if you have a radial pulse, you most likely have a brachial pulse, and so on. I'm also looking if there's any abnormal swelling in their hands as well. Next, I move on to the legs, and I do basically the same thing. You're looking at their skin. You're checking their pulses. I usually like to do the dorsal pedalis, I think that's how you say it, and the posterior tibial pulse. Sorry, that's kind of hard to say. And same thing, if they have pulses in their feet, most likely they have their popliteal pulses and their femoral pulses. I also check cap refill, looking for swelling, is there any abnormal bruising, any of that. Important thing to look for in the legs is if their legs have gotten swollen or they're painful or red, because that could be a sign of DVTs. And that is a big risk when you're in the hospital laying flat, is developing DVTs, and pretty much every single patient should be on DVT prophylaxis, but that's an important thing when you're looking at their legs, is to notice any abnormal skin changes or redness or bruising, anything like that. Next, I like to look at the lines of my patient, so anything that is going in or out of my patient, whether it's an IV, an ART line, a central line, a Swan-Ganz catheter, a Foley catheter. You know, there's so many things that can go in and out of the body, and so I like to check all of my lines, and usually if they have an IV in their right arm, as I'm doing the arms, I'm assessing, is there redness, is there swelling, when's the dressing been changed last, is the IV patent? So I kind of do this as I go down the body, but if they have a Foley and you're wanting to check, is there any irritation, any redness, any swelling, you're also going to want to check to see their urine. How much urine have they put out? What color is it? Is it cloudy? Is it clear? And then you also want to check anything that your patient is hooked up to, so the medications that are running, the fluids that are running, because if you have a patient who maybe is unstable and they're on some blood pressure medications to keep their blood pressure up, if your bag of that medication runs dry, you could be in some trouble when all of a sudden their blood pressure starts dropping because they're no longer getting that medication. So you want to check to see everything that is going in and out of your patient. You want to make sure you verify your orders with what is hanging, and making sure that the medications are running at the correct rate. And if a medication is close to being empty, looking to see if you need to get a new bag of it, or if maybe it's an antibiotic, they're just getting it every 8 hours. It just kind of depends on your patient. So being aware of what medications, what fluids, whatever they're on, and what is going in and out of their body. So that is my basic head to toe assessment. Again, if you have a patient who maybe is in there because they just had surgery or something else, when you get to that area, you're going to focus your assessment on that area. If they're having lung issues or cardiac issues, you're going to focus more on that. But it's good to do a head to toe assessment on every single one of your patients, you know, at least in the morning and then every 4 hours or whatever your hospital's policy is, so that way you can identify any different changes or any trends. The last thing I do is summarize to my patient what I found. If anything, I'll say, you know, okay, I'm done with your head to toe assessment, you're looking great this morning, or I noticed that you're sounding a little wheezy in the lungs, so I'm going to call the respiratory therapist to see if we can get you a breathing treatment. And I just kind of summarize it. I ask if they need anything. Are you hungry this morning? Can I get you some water? Depending on if they're NPO or not. And then I kind of say, okay, well, I'll be back with your ice chips in 5 minutes, and then we'll do morning medications in about 15 minutes, just to give the patient a little heads up on when you'll be back. I also make sure that they have their call light to say, hey, if you need anything, press your call light and I'll be right in, or someone will be right in to help you out. Alright guys, well I hope that helped you out with your head to toe assessment. I know it can be a little intimidating when you're getting used to doing one, but soon it'll be second nature and it'll just be super easy. If you guys have any other things that you always include in your head to toe assessment, leave those down below so I can check that out, and give this video a thumbs up, subscribe to my channel, and I'll see you next time. Bye.